What if your triglycerides are high, but your LDL is not terrible? Should you worry about a heart attack or something else entirely? Many people panic when they see high triglycerides on a lab report. But the real danger depends on how high the number is. Hello everyone, I'm Dr. PK. Today we're talking about high triglycerides, what causes them, how to lower them, and what the real risk is for heart attack and stroke. And here's the key point right from the start. High triglycerides do not always mean the same thing. Sometimes they are a warning sign for future heart disease. Other times, when they are very high, they can raise the risk of pancreatitis. Triglycerides are a type of fat in your blood. Your body uses them for energy. But when you take in more calories than you burn, especially from sugar, refined carbs, and alcohol, your body can convert that extra fuel into triglycerides. Think of high triglycerides like a metabolic traffic jam. Too much fuel is coming in and your body is struggling to process it. The most common causes of high triglycerides are too much sugar and refined carbohydrates, too much belly fat, insulin resistance, prediabetes or diabetes, alcohol, and not enough physical activity. Other causes can include hypothyroidism, kidney disease, liver disease, genetics, and some medications. So the better question is not just how do I lower triglycerides? The better question is what is driving them up? Here is a simple way to think about the numbers. Below 150 is normal, 150 to 199 is borderline high, 200 to 499 is high, 500 or more is very high. And when triglycerides rise close to 1,000, pancreatitis becomes a major concern. If triglycerides are in the 150 to 499 range, the main concern is usually long-term cardiovascular risk. But triglycerides usually do not act alone. People with high triglycerides often also have low HDL, high blood sugar, fatty liver, belly fat, high blood pressure, and insulin resistance. So high triglycerides are often a marker of an unhealthy metabolic environment, and that whole picture raises the risk of heart attack and stroke. Once triglycerides get to 500 or higher, the concern shifts. Now we start thinking not only about heart risk, but also about pancreatitis. And if triglycerides go very high, especially near or above 1,000, that can become urgent. So remember this simple rule, 150 to 499 means mainly heart and artery risk, 500 and above means pancreatitis risk starts to matter too. Now let's talk about what actually works. Number 1, cut sugar and refined carbs. For many people, high triglycerides are less a fat problem and more a sugar and carb overload problem. Number 2, lose weight if needed. Even modest weight loss can help. Number 3, exercise regularly. Number 4, reduce or avoid alcohol. And number 5, treat the root cause, whether that is diabetes, prediabetes, hypothyroidism, liver disease, kidney disease, or medication side effects. Yes, sometimes medications help. If the main issue is heart risk, doctors often use statins first. If triglycerides are very high, especially 500 or above, doctors may also consider prescription omega-3s or fibrates, especially to help reduce the risk of pancreatitis. Let me leave you with this. High triglycerides are often your body's warning light. They usually mean one or more of the following: too much sugar, too many refined carbs, too much alcohol, too much belly fat, or too much insulin resistance. So don't just ask, what pill lowers triglycerides? Ask, why are they high? Because once you fix the cause, the number often improves. I'm Dr. PK. If you found this helpful, subscribe and share this video with someone who needs a simple explanation of high triglycerides.